Face reading, nocturnal emissions. Nocturnal emissions are a result of a deficiency of the spleen and kidney, leading to the functional failure to hold the fluid or of damp heat disturbing the essence chamber. Frequent leaking of semen unrelated to sexual activity is considered an ailment. Clinically, nocturnal emissions are manifested more than twice a week, often accompanied by such symptoms as lightheadedness, tinnitus, forgetfulness, palpitations, and anxiety, insomnia, and dreaminess. Some patients Some patients can also display other symptoms such as frequent urination, an urgency to urinate, and painful urination. The condition can be caused by unrestrained sexual activity, congenital deficiency, overthinking, unfulfilled desires, unhealthy eating habits, and an attack of damp heat. Face reading. If oily, moist red patches appear in the triangular fossa zone of the ear, it suggests that frequent nocturnal emissions have caused fatigue and lower back pain. Therapeutic methods. Patients should learn to adjust their state of mind and know how to be a captive of sexual desire and to instead cultivate the mind. And that at the same time, restraint should be exercised in sex activity and masturbation should be avoided. Dietary advice. This condition is mostly a result of deficiency syndrome. Patients should maintain a diet focused on nourishment and avoid foods that are raw, cold, or of a cold property. Those with hyperactivity of fire due to yin deficiency should avoid foods that are dry and of a warm property. Those with unconsolidated kidney chi should eat walnuts, black beans, and similar foods. Exercise. Persevere in the engagement of physical activities of appropriate intensity, such as walking, jogging, ball games, or yoga, but avoid overexertion. Emotional adjustment. Focus on mental adjustment and cultivation. Keep away from unnecessary arousal and lead a life of few desires. Cultivate a peaceful mind or a peaceful mind and hobbies to enrich your life and avoid overexertion. Medicinal diet therapy. Chicken stewed with Chinese yam and Chinese wolfberries. Chinese yam 500 grams, one chicken, Chinese wolfberries, and salt. Wash the chicken and cut into pieces. Add some water and cook on high heat until it is half done. Wash the Chinese yam, peel the skin and cut it into pieces. Put into the pot, then add the Chinese wolfberries and salt and cook until squashy. Regular intake of this medicinal dish can nourish the kidney and strengthen the essence. Massage. The Shenmen point calms the nerves, tranquilizes the mind, and clears the meridians. It is mainly used to treat heart palpitations, insomnia, and forgetfulness. Combined with the Tai Chi and Zusanli points, it can elevate, to some extent, symptoms resulting from nocturnal emission, such as heart palpitations and insomnia. Massage once or twice a day for 3 to 5 minutes each using the pad of your thumb. The Shenmen point. Thank you for your attention. Interviewing anger 2. In some cases, anger can affect other organs, especially the stomach. This can be due to stagnant liver qi invading the stomach. Such a condition is more likely to occur if one gets angry at mealtimes, which may happen if family meals become occasion for regular rows. It only happens when there is a pre-existing weakness of the stomach, in which case the anger may affect only the stomach without even affecting the liver. If one regularly gets angry an hour or two after meals, the anger will affect the intestines rather than the stomach. This happens, for example, when one goes straight back to a stressful and frustrating job after lunch. In this case, stagnant liver qi invades the intestines and causes abdominal pain, distension, and alternation of constipation with diarrhea. Finally, anger, like all other emotions, also affects the heart. This is particularly prone to be affected by anger because, from a five-element perspective, the liver is the mother of the heart, and often liver fire is transmitted to the heart, giving rise to the heart fire. Anger makes the heart full with blood rushing to it. With time, this leads to blood heat affecting the heart and therefore the mind. According to Dr. J.H.F. Shen, anger tends to affect the heart, particularly when the person does a lot of jogging and exercising. This is because excessive exercise dilates the heart, which is then more prone to be affected by the transmission of fire from the liver to the heart. In some cases, anger disguises other emotions, such as guilt. Some people may harbor guilt inside for many years and be unable or unwilling to recognize it. They may then use anger as a mask for their guilt. Moreover, there are some families in which everyone is perpetually angry. This happens more in Mediterranean countries such as Italy, Spain, or Greece. In this family, anger is used to mask to hide other emotions such as guilt, fear, or dislike of being controlled, or to conceal weakness or an inferiority complex. When this is the case, it is important to be aware of this situation as one needs to treat not the anger but the underlying psychological and emotional condition. Anger. Anger affects the liver and heart. Anger makes chi rise. Anger expressed causes liver yang rising. Repressed anger causes liver chi stagnation. Anger at mealtimes affects the stomach. Anger after eating affects the intestines. Anger may disguise guilt. Thank you for your attention.
Let's discuss Han Jiangmin, large intestine meridian, support and rush out. LI18 on the anterior aspect of the neck at the level of superior level of thyroid cartilages between the anterior and posterior border of sternocleidomastoid muscle. LI18s who to support and rush out support the prominence, relieve prominence, protuberance, assistance, water hole, window of the sky. The neck is the bridge to our head, the home of our senses, and the heavenly part of the body. This bridge needs to be unobstructed. There needs to be a free flow for change and evolution to occur. In the same way that the chi of this point supports the local physical structure of the laryngeal prominence, it supports and assists the mind and spirit, so that the large intestine can release at this level and see afresh. All windows of the sky brighten the sense organ in the head. Our senses are the way we receive and interact with the world, and this point can revitalize our view of life. It can support and strengthen one's ability to let go from difficult or painful circumstances and allow new vistas and perspectives to unfold. When combined with Li4, these effects are further enhanced. This point is important for the free expression of lung and large intestine qi, which makes connections or bridges in relationship and allows letting go at endings. If the poo has been so afflicted by sadness and grief that the heart and lungs have become constricted, then a natural condensing of lung qi becomes oppressive, and in turn this impacts on the large intestine. In its role as a propagator of the correct way to live, while synchronized with the natural rhythms of life, large intestine needs heavenly chi to give it to the impetus to carry out its role and so enable a new cycle of experience. The long large intestine needs sufficient sense of connection with the chi of heaven and the processes of life that letting go will not cause anxiety or a feeling of deprivation. They know the cycle of life inspiration will continue. A heavenly a healthy large intestine official enables us to move forward with our life while retaining what is of value from the past. Support and rush out is a helpful point when a person is mired in loss, disconnection, and isolation, possibly moldering in toxicity and resentment, and the past they can they can't see the next step to take. Toxicity distorts communication and comprehension and leads to misunderstandings. This point allows clarity and movement into situation and helps bring balance to body, mind, and spirit. At the physical level, it benefits the throat. It's used frequently for throat problems, whether infectious, such as mumps, tonsillitis, laryngitis, phlegm-related problems such as nodules or goiter, or in need of lubrication, hoarseness, and difficulty swallowing. Also, when there is rashes from acne or boils on the throat, this point can be used locally. Relieves cough, dissolves phlegm, and disperses masses. Indication, toxicity of mind and spirit, inability to let go and move on, problems in the throat. This point goes to the spirit of LI, bringing light, clarity, and perspective to a patient suffering under the weight of sadness or grief. It supports the LI process of letting go of thoughts and situations that do us no good so that a new perspective may come in and the patient can move on in life. It has a cleansing effect and is helpful for throat problems such as excessive mucus, cough, speech, or swallowing difficulties. Thank you for your attention. Let's discuss heart patterns, phlegm fire harassing the heart. Concept this pattern is due to a combination of phlegm and fire obstructing the heart orifices and harassing the mind, resulting in mental disorders. Clinical manifestation, fever, mental restlessness, reddish complexion, red eyes, thirst, hoarse breathing, constipation, and yellow urine, yellow and sticky sputum, or a rattling sound in the throat, insomnia, a suffocating feeling in the chest, heart fixation, even mania or delirium, violent and aggressive behavior, such as the tendency to beat or scold people and destroy objects, incoherent speech, uncontrolled weeping and laughing without obvious reason, a red tongue, yellow and greasy coating, a slippery and rapid pulse. Analysis, this pattern is mainly caused by severe emotional irritation, leading to stasis of chi, which turns into fire, and fire scorching and changing the fluids into phlegm, or by exterior pathogenic damp heat, which accumulates inside the body, resulting in phlegm fire, or by invasion of exterior pathogenic heat, which burns the fluid into phlegm, and phlegm fire harassing the heart. These symptoms, mental disorders, and manifestations of interior phlegm fire, such as yellow and sticky sputum, red tongue, yellow and greasy coating, slippery and rapid pulse, etc. So here, the analysis of phlegm fire harassing the heart. When there is warm heat, this is the interior heat steams skin and flesh. There's fever. Interior heat blazes upward. There's reddish complexion and eyes, coarse breathing. When there's phlegm fire disturbs the mind, there is delirium or mania. For the internal production of phlegm due to organ damage, there is exuberant phlegm, fire blocking, and harassing the heart. resulting in heart fixation, insomnia, mild. There's violent behavior or a tendency to hit or scold people, incoherent speech, uncontrolled laughing or weeping if severe. For the heat endures the fluid, there is constipation and yellow urine. For the exuberant interior phlegm fire, there is yellow and sticky sputum or rattling sound in the throat. For phlegm blocking the chi dynamic, there is chest suffocating. For the red tongue with yellow and greasy coating, a slippery and rapid pulse. Here, the differentiation of phlegm misting the heart orifices and phlegm fire harassing the heart. For the phlegm misting the heart orifices, the nature is yin pattern. There are similar symptoms, mental disorders, accompanied by a phlegm pattern. For the different symptoms, there is clouding of consciousness, apathy, depression, dementia, without a heat pattern. For the phlegm fire harassing the heart, the nature is a yang pattern. For the different symptoms, there's mania, delirium, violent behavior, reddish complexion, fever, etc. with an obvious dry heat pattern. For the summary, phlegm heat harassing the heart, etiology, there is excessive consumption of phlegm-forming foods, severe emotional problems, invasion of exterior heat. Underlying or accompanying pathology, spleen chi deficiency, dampness and phlegm, heart chi deficiency, heart blood deficiency. For the signs and symptoms, a mental restlessness, bitter taste, palpitation, thirst, red face, tightness in the chest, dark urine, expectoration of phlegm, rattling in the throat, insomnia, vivid dreams, agitation and confusion, incoherent speech, rushed behavior, uncontrollable laughter or crying, depression, manic behavior. For the pulse, there is full, rapid, slippery. Tongue, there is red body with deep midline crack to the tip, yellow sticky coating, tip may be redder and swollen. For the treatment principle, we need to drain heart fire, calm the shen, transform phlegm, and open the heart orifices. For the acupuncture treatment, we use PC5, dissolves phlegm from the heart. Heart 8 clears the heart fire. PC7 pacifies shen, clears heart fire. Bladder 15 clears heart fire. Stomach 40 resolves phlegm. Liver 2 subdues fire. GB15 pacifies shen. Heart 7 clears heat, calms shen. Heart 9 clears heart, opens the orifices. Ren 15 pacifies the shen. Ren 12 supplements spleen chi. Spleen 6 resolves phlegm, calms shen. Do 20 restores consciousness. Needle with drainage. For the relevant advice, the patient should avoid consuming anything that creates heat, such as chili, pepper, garlic, dark chocolate, alcohol, too much red meat, especially lamb, fried foods such as crisps, chips, falafel, and so on. They should also avoid phlegm and damp-producing foods such as sweets, sugar, wheat, dairy products, bananas, avocados, dried fruit, and so on. It is important that the shen is not agitated further by stimulants such as coffee. Thank you for your attention.
For pulse taking, we discuss swift pulse and boiling bubbles pulse. The rate of a swift pulse is in the range of 140 to 180 beats per minute. The rhythm is basically regular. A swift pulse indicates excessive yang and depleted yin with genuine qi on the verge of exhaustion. A swift and taut pulse indicates blazing yang heat and depletion of yin fluids, which occurs in the severe or risk cases. A swift but feeble pulse indicates depletion of yang qi. The pulse becomes swift principally because genuine yin is on the verge of exhaustion, so that unopposed yang rises without restraint, or because extreme yang heat causes blood to flow rapidly. So indications, raising and the forceful pulse would indicate hyperactivity of yang and excessive heat. Raising and forceless pulse would be yin exhaustion and antipathogenic Qi collapse. Biomedicine, there is hypertensive cardiopathy, coronary heart disease, hyperthyroidism, myocarditis, and pericarditis. Auricular flutter accompanied with regular 2:1 AV block or functional tachycardia. Pathogenesis, yin exhaustion with hyperactivity of yang or excessive pathogenic heat causes acceleration of the blood flow and a high pulse rate. This is a critical pulse. However, this pulse rate is considered normal for the healthy infant. So a swift and taut pulse, the rate is 140 to 180 beats per minute with regular rhythm. This is hyperactive yang heat, exhaustion of genuine yin, genuine qi on the verge of exhaustion. Clinical significance, hyperactive yang heat and exhaustion of yin fluid. Swift and feeble pulse indicates depletion of yang qi. The rate of the boiling bubbles pulse is generally above 180 beats per minute, but the beats are often too indistinct to be counted accurately, which is a sign of the severity of the illness. The pulse is palpable by light touching. The ancient physicians used the metaphor of the bubbling of boiling water with bubbles that float but have no root. A boiling bubbles pulse indicates that yang heat is extreme and yin fluid has dried. This is a danger sign. Analysis, extreme heat in the three yang meridians causes blood to flow very rapidly. As yin blood dries, the vessels become less and less filled, hence the pulse becomes floating and feeble. So the boiling bubbles pulse rate is over 180 beats per minute, feeble and floating. This is extreme heat in the yang meridians, which accelerates blood. Thank you for your attention. Diagnosis according to Zhang-Fu organ patterns. This time we'll discuss liver blood deficiency, generating liver wind. This condition will arise when liver blood, which is an aspect of the liver yin, is too weak to anchor liver wind, which is an aspect of liver yang. When there is blood deficiency, it is as if blood doesn't completely fill the vessels, so a vacuum in the vessels arises through which wind can move. This is similar to the gusts of wind that blows through underground railway tunnels, where the vacuum created by the train in the tunnel draws in air that then rushes around the tunnels. Similarly, wind can rush around the vessels and channels when there is a vacuum created by blood deficiency. The etiology is the same as for liver blood deficiency. Symptoms and signs: dizziness, tremors, muscle spasms, tics, tingling sensation or numbness in the limbs, difficulty focusing the vision, floaters or spots in the visual field, insomnia, poor memory, sparse or no menstrual bleeding, pale lips, dry lips, pale and sallow complexion, weak, hesitant voice that lacks resonance, pale, thin, and dry tongue with pale sides, choppy or fine pulse. Liver 3 and bladder 18 nourish liver blood and extinguish internally generated wind. Liver 8, bladder 17, stomach 36, and spleen 6 nourish blood. Do 16, GB 20, and Do 20 extinguish internally generated wind, especially when the symptoms affect the head. Li 4 calms yang and thereby internally generated wind. Liver blood deficiency generating liver wind can be caused by liver blood deficiency and can lead or result in phlegm wind. So to summarize, liver blood deficiency engendering wind, etiology, diet poor in nourishment or lacking in protein, blood loss, excessive physical work, chronic illness, too much sexual activity. Underlying accompanying pathology, chronic deficiency of liver blood. Possible presenting conditions, fright, wind, or convulsions in children. Signs and symptoms: fine tremor, facial tic, dizziness, blurred vision, numbness and tingling of limbs, poor memory, insomnia, light menstruation. Pulse, wiry, fine, tongue, pale and thin. Treatment principle, nourish blood and extinguish wind. Acupuncture treatment, liver 2 and liver 3, to calm the liver, extinguish wind. Spleen 6, to regulate the liver, nourish blood. GB20 will extinguish interior wind. LI4 eliminates wind from the face. SJ5 extinguishes wind, benefits head. Do19 eliminates wind, calms tremors. REN4 nourishes blood using moxa. Bladder 20, chronic infantile fright wind, convulsions. Do20 to extinguish interior wind. Liver 8 nourishes liver blood. Bladder 18 nourishes blood. Kidney 3 enriches kidneys to nourish blood. Bladder 17 with moxa nourishes liver blood. Thank you for your attention. Tongue inspection, clinical significance. Because the tongue and its coating reflect the conditions of an illness in different ways, they must be examined and analyzed together to arrive at a more reliable understanding of the state of the illness. The most important clinical significance of tongue diagnosis is as follows. 1. The state of genuine qi. A red and moist tongue indicates ampleness of qi and blood, whereas a pale tongue indicates insufficiency of qi and blood. A thin, white, and moist coating of the tongue indicates ampleness of stomach qi, whereas the absence of a coating indicates decline or exhaustion of stomach qi and stomach yin. Second, location and severity of illness. In an exogenous illness, a thin and white coating indicates a mild illness, whereas a thick and yellow coating indicates a more severe illness with the pathogenic evil in the interior. A red tongue indicates heat in the qi level, whereas a crimson tongue indicates that heat has entered the nutritive and blood levels. Third, nature of causative factors. A white coating suggests cold, whereas a yellow coating suggests heat. A wry tongue indicates the stirring of endogenous wind. A bluish-purple tongue suggests blood stasis. Fourth, progression and regression of illness. In general, certain changes suggest that the illness is progressing from the exterior to the interior, from mild to more severe, or that cold is transforming into heat and heat is damaging fluids. These changes are the following. The coating changing from white to yellow, then to gray, and finally to black. The coating changing from thin to thick, and from moist to dry. And the tongue itself changing from pale to red, then to crimson, and finally to purple. If the changes occur in the opposite direction, then the illness is moving from interior to exterior, from severe to mild. Fifth, prognosis. If the coating is normal and the tongue is light red, moist, and supple, then genuine qi is still adequate and stomach qi not depleted. The prognosis is good. If the coating shows sloughing and the tongue is dusky and abnormal in mobility, then genuine qi has declined and stomach qi exhausted. The prognosis is poor. Thank you for your attention. Epigastric pain due to stomach-yin deficiency. The symptoms of stomach-yin deficiency have already been discussed. The tongue variations can be helpful in making an accurate diagnosis. So we will show you examples of stomach-yin deficient tongues with central cracks or peeled patches in the center. So the first one is stomach cracks. Second one is the central stomach crack. If there is empty heat, there will be some additional symptoms, such as feeling of hunger, night sweating, 5-pound heat, bleeding gums, feeling of heat in the evening, red tongue without coating in the center, floating empty pulse on the right middle position, and slightly rapid. So this is an example of a tongue with no coating in the center. Both acupuncture and Chinese herbs give excellent results in the treatment of epigastric pain. Of all the patterns discussed, the most difficult to treat are stasis of blood in the stomach and phlegm fluids in the stomach. The easiest to treat and probably the one that best reacts to acupuncture is liver qi invading the stomach. This is also one of the most common patterns seen in epigastric pain. Irrespective of the Western diagnosis, proper diagnosis and treatment will yield results. For example, if a patient with epigastric pain is found to have a stomach ulcer, this should be treated according to the aforementioned identification of patterns. And if our diagnosis and treatment are correct, both acupuncture and Chinese herbs will promote the healing of such an ulcer. Obviously, if a patient older than 40 has been suffering from epigastric pain and poor digestion for some years, a Western diagnosis should always be sought to exclude the possibility of stomach cancer. Thank you for your attention.